This donning procedure assumes the facility has elected to use a powered air purifying respirator, or PAPR, and a coverall. An established protocol facilitates training and compliance. Use a trained observer to verify successful compliance with the protocol. The trained observer will read aloud to the healthcare provider each step in the donning procedural checklist and visually confirm and document that the step has been completed correctly. The trained observer in the donning process is a dedicated individual with the sole responsibility of ensuring adherence to the entire donning process. The donning process is conducted under the guidance and supervision of a trained observer who confirms visually that all personal protective equipment is serviceable and has been donned successfully. The trained observer should suggest to the healthcare provider that he or she attend to personal needs, such as using the restroom and hydration, prior to donning personal protective equipment. The trained observer uses verbal commands and a written checklist to confirm each step in donning personal protective equipment and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair should be visible at the conclusion of the donning process.
We're now going to work together carefully to put on your personal protective equipment. I'm going to be here with you and tell you how to put everything on properly. I am here to keep you safe. We're going to do everything slowly and methodically. If you have any issues or questions, just stop and feel free to ask me whatever you need to. I'm going to give you verbal instructions and you're going to acknowledge them back to me.
Before starting the donning procedure, change into clean surgical scrubs or provided disposable garments and dedicated washable footwear, such as plastic or rubber materials, in a suitable clean area. All footwear should be closed-toe and closed-heel with no holes. No personal items, such as jewelry, watches, cell phones, pagers, pens, should be brought into patient room.
The first thing I need you to do is remove any jewelry, earrings, rings, watches, anything that might be around your neck or waist. Please make sure that you also don't have your ID badge on or pens or cell phones in your pocket. Let's make sure that your hair is pulled back off of your face and also off of your neck and back. Let's take a look at your equipment and make sure that everything is intact.
Visually inspect the personal protective equipment ensemble to be worn to ensure that it is in serviceable condition and that all required personal protective equipment and supplies are available, and that the sizes selected are correct for the healthcare worker. Some PAPR models are self-contained. It is important to follow the manufacturer's instructions carefully for the specific PAPR model you are using. Test the PAPR to ensure the battery is fully charged and the airflow is working properly. Visually inspect the PAPR hood to ensure there are no cracks in the face shield and the hood is intact. The trained observer reviews the donning sequence with the healthcare provider before the healthcare provider begins the donning process and reads it to the healthcare provider in a step-by-step fashion using a checklist.
Do you see any problems with your equipment? No? Great. First, before any procedure, we need to perform proper hand hygiene. Go ahead and use the alcohol-based hand rub. Make sure that you get in between your fingers, the backs of your hands, and your wrist. Great, now make sure that your hand's completely dry before we move to the next step. Now we're going to put on your boot covers. For safety, go ahead and sit in the chair and take your time.
Make sure that all areas of the foot are covered and the boot covers are snug over your ankle and calf. If your boot covers have a strap, wrap the strap around for a comfortable fit. Try not to touch the floor or other areas with your hands while putting the boot covers on. If you do, disinfect your hands before putting your inner gloves on.
Now we're going to put on our first pair of gloves. Do this as you normally would. It does not need to be done in a sterile fashion. Make sure that the cuffs of the gloves go as far up your arm as possible. Now you're going to put on your coverall. Please inspect it and make sure there are no holes or tears. Take your time. Put the coverall on slowly and methodically.
If available, coveralls with thumb hooks help secure the cuffs of the gown over the inner glove to help ensure there is not a gap between the glove and cuff of the coverall. Put on your coverall with the zipper in the front. Pull up the zipper completely. Ensure the coverall is large enough to allow unrestricted freedom of movement. Ensure cuffs of inner gloves are tucked under the sleeve of the coverall. If a coverall with thumb hooks is not used, facilities may consider taping the sleeve of the coverall over the inner glove to prevent potential skin exposure from separation between the sleeve and inner glove during activity. If taping is used, a tab should be created by folding the tape over at the end. This tab will help facilitate easy removal during the doffing process. Care must be taken to remove tape gently. Experience from some facilities suggests that taping may increase risk by making the doffing process more difficult. Attach the hose to the PAPR battery pack and filter. The trained observer will hold the respirator at the small of the back, while you fasten the belt around your waist snugly and secure any loose straps. The PAPR battery pack and filter unit should be on the outside of the gown to ensure proper airflow.
Now you're going to put on your outer gloves. If you need help with this, just let me know.
Put on the second pair of gloves with extended cuffs. Some facilities may choose to use outer gloves of a different color to easily identify rips or tears. Ensure the cuffs are pulled up and over the sleeves of the coverall.
When putting on these gloves, make sure that the cuffs extend as far up your arm as possible.
Double gloving provides an extra layer of safety during direct patient care and during the personal protective equipment removal process. Put on the single-use PAPR hood so that it fully covers the neck and extends over the shoulders.
You're going to put on the hood so that the opening is in the front.
Be sure that the hood covers the head and all of the hair, neck, and ears, and that it extends past the neck to the shoulders. The trained observer will turn on the PAPR and attach the PAPR blower tube to the PAPR hood and make sure that the tube is snapped and fits. If a PAPR unit should stop during patient care, you must leave the patient area immediately. The trained observer should do a final check that all areas are covered and no hair is protruding from the hood. If the patient is vomiting or has diarrhea, put on a single-use, fluid-resistant, or impermeable apron that covers the torso to the level of the mid-calf. The apron provides an additional layer of protection to the front of the body against exposure to body fluids or excrement from the patient. After completing the donning process, the integrity of the ensemble is verified by the trained observer.
I'm going to check to make sure that you are comfortably able to move with this equipment on.
The healthcare provider should be comfortable and able to extend the arms, bend at the waist, and go through a range of motions to ensure there is sufficient range of movement while all areas of the body remain covered. The healthcare provider should have an unobstructed field of vision through the hood. A mirror in the room can be a useful tool for the healthcare provider while donning personal protective equipment. When moving in the PAPR equipment, be sure to move slowly.
Okay, everything looks great.
Before you move to the patient's room and into the doffing area, you will need to take a few minutes to do some important things. First, get the attention of the trained observer. Once he or she signals to you that it's clear, enter the doffing area. Inspect your personal protective equipment. Are there any obvious signs of contamination or materials on it? If so, you will need to disinfect the surface of the personal protective equipment with an EPA-designated disinfectant wipe. Last, disinfect your gloves, also with an EPA-designated disinfectant wipe, or alcohol-based hand rub. You, your trained observer, and the assistant are a team throughout the doffing process. The trained observer will read each step aloud, giving you the time to take the required action. The assistant will help you when necessary. Remember, don't rush through the doffing process. Take your time and be careful.
I'm here to help you through the doffing process. You'll hear me give directions that are not part of standard practice, but are designed to keep you safe. As you remove each item, it is important to place it immediately in the designated waste receptacle. We're going to work through this together. We need to check for any rips, tears, or contaminants on your clothes. Now I'd like you to disinfect your outer gloves.
The first thing you will do is use an EPA-registered disinfectant wipe or an alcohol-based hand rub to disinfect your outer gloves. The wipe will be used to remove any visible contamination. If you're using an apron, you now need to remove it. The assistant will assess the type of apron used and will assist with untying the strap. Then, you will remove the apron by breaking the strap or lifting the strap over your head, rolling from the inside to outside and away from your body, and discarding it in the appropriate receptacle. If the apron can be gently pulled away from the body by tearing it at the neck, this process should be used. Once the apron is off, inspect your personal protective equipment for visible contamination, cuts, or tears. If you see your personal protective equipment has been compromised, or if there are any signs of contamination, disinfect it with an EPA-registered disinfectant.
Okay, great. Now disinfect your gloves.
You will need to disinfect your outer gloves again with an EPA-registered disinfectant wipe or an alcohol-based hand rub.
In the next step, you're going to remove your outer gloves. Please do this slowly and carefully to avoid contaminating or tearing your inner gloves.
In this example, the boots are under the coverall and are being removed later in the sequence. However, depending on the personal protective equipment used at your institution, the boot cover may be removed at this point in the sequence or later on in the sequence. Now it's time to remove the outer gloves. There are two very important things to remember. First, pay special attention so that you don't contaminate or tear the inner glove. Second, don't snap the gloves, which could cause spray. Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then, roll it down until the glove is completely off your hand, in a ball, in the palm of the other hand. Then, slide a finger down and inside the outer glove on the other hand, and pull it off until it's balled around the first glove. Dispose of the gloves.
Good job. Now inspect both sides of your inner gloves for visible tears or contamination.
If you do see a tear, hole, or signs of contamination of the inner gloves, disinfect with EPA-registered disinfectant wipes or alcohol-based hand rub. Then, remove the inner gloves, making sure not to contaminate your bare hands. Once the gloves are off, perform hand hygiene with alcohol-based hand rub on your hands. Then, put on a new set of gloves up to the edge of the coverall sleeve.
Okay, great. Now disinfect your gloves.
Now, use your EPA-registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Now you're going to remove your respirator. The assistant can help you with this.
In this step, you will take off your belt-mounted respirator. How you do this will vary from model to model of PAPR, so you and your assistant will need to refer to the manufacturer's specifications.
The assistant will detach the hose and turn off the system now.
Although the specifics will vary, you should do things in this order. First, the assistant will detach the hose from the hood. Then, while the assistant holds the belt unit in his or her hands, you will unclasp the belt. Place all reusable PAPR components in a designated area or container for later disinfection. Next, you will take off the hood. The assistant will stand behind you and grab the outside of the hood, and roll the hood up towards the top of the shoulders, forming a cuff. When your assistant tells you to do so, you will grab the hood near the ears, bend forward at the waist, and pull the hood slowly and methodically down and away from your head until it's at waist level. Discard the hood into the trash receptacle. It's very important that you don't touch your face after removing the hood.
Please disinfect your gloves now.
Now, use your EPA-registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Next, you will remove your coverall. Start by unzipping it completely, and your assistant will help guide you from there.
If your coverall has a flap covering the zipper, you must gently pull it open. Then you will need to disinfect your gloves. Next, tilt your head back and reach for the zipper at the top of the suit, using a mirror to avoid touching the skin. Grasp the zipper with 2 fingers of one hand, without using the other hand, on the front of the suit, and pull down. Unzip completely. The assistant may help you unzip the coverall if necessary. The assistant will stand behind you and grasp the outside of the coverall at the shoulders, and pull it off your body in a downward motion until the coverall is off your shoulders completely. The assistant will then reposition his or her hands and roll the suit outward and down the back in a controlled fashion, removing your arms and slowly pulling it down until it's at your waist, being careful not to touch your scrubs or skin.
Be sure to move slowly and deliberately to avoid contamination of any exposed surfaces.
To get the coverall off the rest of the way, you may need to sit down in a clean chair, which will be marked clearly. Grab the coverall and pull it away from your body, one leg at a time. Once the coverall is off completely, dispose of it.
You're doing great. Now go ahead and disinfect your gloves.
Now use your EPA registered disinfectant wipe or alcohol-based hand rub to disinfect your gloves.
Next, I'd like you to remove your shoe covers. You can sit down in the chair to make it easier.
Sit in the designated clean chair to take off your boot covers only. Once you sit down, be careful not to touch one leg with the other. Grasp the outside of the boot cover and pull down toward your ankle. Then, lift the boot covers over your heel, pull it off your foot, and dispose of it correctly. The exact way to remove the boot covers will vary based on the manufacturer's instructions.
You're doing great. Now go ahead and disinfect your gloves.
Now use your EPA registered disinfectant wipe or an alcohol-based hand rub to disinfect your gloves.
Please have a seat in the clean chair so that you can disinfect your shoes.
To disinfect your shoes, sit down in the clean chair. This will be designated as the clean chair. Once you're sitting down, use the EPA registered disinfectant wipes to thoroughly disinfect all the surfaces of your shoes, moving from top to bottom and including the soles. Be sure not to touch your ankles.
We're getting near the end. You're doing great. Now disinfect your gloves.
Now use your EPA registered disinfectant wipe or an alcohol-based hand rub to disinfect your gloves.
Now we're going to remove your inner gloves. Be careful to do this slowly to avoid tearing the gloves or contaminating your hands.
Now it's time to remove the inner gloves. Like with the outer gloves, there are two very important things to remember. First, pay special attention so that you don't contaminate your hands. Second, don't snap the gloves, which could cause spray. The process to remove the inner gloves is the same as it was with the outer gloves. Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then roll it down until the glove is completely off in a ball in the palm of the other hand. Then, slide a finger down and inside the glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves. Once your gloves are off, it's very important that you don't touch your face, any exposed skin, or any surface in the room.
Go ahead and perform hand hygiene.
Next, perform hand hygiene using alcohol-based hand rub on your bare hands.
Okay, one more important step. We need to check for any rips, tears, or contaminants on your clothes.
Now you, the assistant, and your trained observer will do one last inspection of your scrubs and inner clothing for holes, tears, or contamination.
Please hold your hands out to your side and slowly turn around.
Congratulations! You've now successfully finished the doffing process, so you can leave the doffing area. You need to find the closest designated shower where you can remove your scrubs and bathe with soap and water. A shower is recommended at the end of each shift for the comfort of the healthcare worker.